Look at me. So I put a little bit more numbing medicine. Try to get away from the malar edema area, you know, I don't want to disturb that. Okay, you can see that the white color here, a little bit from the numbing medicine, the light with Appy. So this area I try to avoid was the malar edema area. Okay, so I numbed both sides, so we're gonna do, relax, you're gonna do the under eye filler with, I like to do it with cannula, try to get away and now this area is numb, and then I'll do a little opening for the cannula. Okay, so I'm doing 23 gauge cannula, so the needle is 22 gauge, a little bigger. Okay, and then when I go inside, I try to go deep, almost touch the bone, and then I advance deep. Sometimes you have resistance, so you have to wiggle your way a little bit gently so that you stay deep and not create a lot of pressure. Okay, look at me a little bit. Again, starts to find the tip is here, I can feel it. Okay, alright, so here try to advance sometimes. Alright, here we go. So sometimes as you said, like you have resistance, you have to wiggle your way so that you go a little bit deeper or more superficial, so you don't go through that fibrous tissue. And then I felt the tip all the way to the tear trough. Now I'm deep, I aspirated negative, and then I start injecting very gentle as I come out. It's very important to inject deep when you're doing the tear trough so that you don't have the lumpiness that you sometimes see when you're doing tear trough. And always remember, you want to undercorrect, undertreat, because although using Bolitero, which absorb water the least compared to the other fillers, but still all the fillers, hyaluronic acid fillers, are hydrophilic. You can see a little dip here. I'm not sure if you can see it with the camera, but I'm gonna go there a little bit. I feel the tip of the cannula and I know I need to inject there. So in a few weeks the filler will also absorb some water, so it's gonna be a little bigger than what you see now and more full. So you want to again undertreat, and then the periorbital to the side, sometimes I have a little left. I like also to inject that area. You okay? Okay, I feel the tip here. Always protect the eyeball. By doing this, I'm doing both. I'm protecting the eyeball and I'm feeling the tip of the cannula. Okay. So she has a lot of redundant skin here and coloration. This coloration will be better, and the skin will be a little smoother as well. Okay, and then we'll go to the other side. A little pinch. Again, we numb this area. So the pilot needle, I'm making a little opening. 22 gauge needle, and then the cannula is 23, a little smaller, so the opening is a little bigger than the cannula. Okay, the same thing, I'll try to pull the tissues like this so I go deep. You can see that I'm like under the muscles, deep tissue, just almost above the bone. Okay, and then again, this is the tip. I need to advance a little bit. The same thing, if you feel a little resistance, try to to move direction so that you're not too rough, and advance against a fibrous tissue or something. So I think I'm all the way where I need to. Again, I like to aspirate at least here at the beginning. These cannulas, you can see the dot, so it tells me where's the bevel. So I like to have to be pointing up, and then as I'm coming out, the same thing, I start injecting. So I'm injecting at a deep, plain, and not superficial, so that doesn't look lumpy when we finish. Okay, so that's also okay. Look at me like this. Looks good. So I have 0.1 or 0.2 left. Again, maybe we'll fill the periorbital. Sometimes go to the other side. So get me like this. I can go same opening, and then after I'm under the skin and the muscle, I go and direct it. Okay, I can still feel the tip of the needle, and let's see the bevels up. Again, very small amount. You can always again protect the eyeball and feel the tip of the cannula to see where you need it, inject where you need it. I'm putting little small boluses along the, let me see how it looks. Okay, a little better. Maybe I'll just do it there as well. Same thing. Okay, so here again protecting the eyeball. Okay, almost done. Okay, so not necessarily you need to use everything in the syringe when you're doing any kind of treatment, not only this, but sometimes if your patient still needs it, you can correct certain things, then why not, you know. So in here we need a little bit here. We're almost done anyways, so I think she'll benefit if we inject the rest into this area. You can see that we corrected not only, I finished the tear trough, and then whatever left. Also, a lot of patients, they have this area, we call it the periorbital rim here, to the sides, also needs to be filled, so that is all around looks nicer and better, and it will help with the sunken, you know, under eye, the hollowness, with the coloration, discoloration as well, to the side as well. So it's all one unit. So I think it all looks good now. So sometimes as well you can gently massage it, although she doesn't need it in her case. But if you see any lumps, the best time to correct any lumpness is when you're just injecting actually, and because everything is still fresh and you can mold anything you need. Also when you're doing lip filler and all that stuff, everything is easier to do when you just finish. And I recommend the patient not to correct any lumpiness, even for the lips. Sometimes I tell them to tap a little bit gently, because you don't know how they're gonna do it. You know, some patients will do it differently, more aggressive than others. Some will do it correct, but some will not. So you don't know which one, if you recommend that, will do it the right way. So you'd rather do it yourself. Okay, let me know if you have any